started the timer and here is your question.
Good. Okay.
So if you have read and understood, considering it's surgical anesthesia, kindly please tell me what are you looking at? What are these arrows, if you can identify?
This is a plain X-ray skull,
Yes, showing what?
lateral view and AP view.
Yes.
The arrow marks are the tributaries of dural venous sinuses,
Okay, what are they called?
imaginary veins.
Yes, very good. All right. Okay, can you also tell me? All right, wait just a second. I have to remove one. All right, here. If you can identify what is 1 from 1 to 8. If you can identify all of these, please.
Number 1 is the terminal point of superior sagittal sinus.
Okay.
Number 2 is the straight sinus.
Yes.
Number 3 is the
Just
number
try
2
to
is
guess.
the,
Yes.
inferior sagittal sinus.
Okay. 4.
And 3 is the continuation of inferior sagittal sinus draining into great
Yes.
into straight sinus.
4.
And number 4 is the sigmoid sinus.
Okay. Number 5.
Number 5 is the inferior petrosal sinus.
6, please.
Superior petrosal sinus.
7.
And 7 is cavernous sinus.
8.
8 is sphenoparietal sinus.
Okay. Can you tell me how would you broadly classify dural venous sinuses?
Paired and unpaired.
Very good. Can you
Paired
tell me? Yes.
Paired sinuses are from anterior to posterior sphenoparietal sinuses. Then the superior inferior petrosal sinuses, cavernous sinuses. Then transverse sinus, sigmoid sinus. These are the paired sinus. Also
Paired.
anterior and posterior
Yes.
cavernous. The mentioned sinuses before are the paired sinuses, and the unpaired sinuses are superior and inferior sagittal sinus,
And
straight anterior posterior cavernous communicating sinus, and the straight sinus and
okay.
obstructive sinus.
So there are 4 unpaired and 6 paired ones. Total,
Yes, ma'am.
yes, total 10 in number. So can you tell me, please, what is cavernous sinus? How is it formed?
Cavernous sinus is are paired sinuses.
Yes.
Located on both sides of the sella turcica,
Yes.
and it drains from anterior both superior ophthalmic veins,
Yes.
sphenoparietal sinuses, also some imaginary veins,
And facial veins.
yes,
And
ma'am.
facial veins and sphenoparietal sinuses. They drain blood too.
sinuses.
They drain blood too.
it drains blood to superior inferior petrosal sinuses, also anterior and posterior intracavernous sinuses.
Yes.
Uh,
Okay. Can you please tell me what lies in the lateral border of the venous sinus, or what
in
is
the
on the, yes,
on the lateral wall of cavernous sinus from above to from
below?
above
Yes.
below there
Yes.
are oculomotor nerve, maxillary and mandibular nerve,
Yes.
then and then the trochlear nerve.
Okay. Ophthalmocochlear, oculomotor, and venous sinus. Okay. Can you please tell me what you understand by the venous sinus thrombosis? How does the patient presents when has this condition?
Cavernous sinus thrombosis is a formation of thrombus within cavernous sinus. It manifests as the common signs presenting are orbital swelling. There may be ophthalmoplegia, cranial nerve pulses of cranial nerve 3, 4, 5, 6.
Yes. And
So
gradual loss of vision. Did you mention that?
gradual loss of vision.
Okay. Right. Can you also tell me why the sigmoid sinus is called sigmoid sinus?
Because of its shape, like
Like
it's a
sigma?
sigmoid.
Yes. Yes.
That's why it's called sigmoid sinus.
Okay, good. Can you please tell me what are the contents of the carotid canal?
Contents of the carotid canal: internal carotid artery, sympathetic nerves. These are the contents.
Okay. Can you look at this image and recognize ethmoidal sinus?
Ethmoidal sinus. Mm,
Actually, in the image, I have to show you if you could see. Okay, what is this area called?
Sorry, ma'am.
What is this area called?
Sorry, ma'am. The sound is not clear.
Yes, this area I'm pointing at, what does it called?
This area is the pituitary fossa.
Outside, okay, if you can identify ethmoidal sinuses. There are two, if you could see, or if you can tell me where are the coronal sutures. Would you be able to identify in any of these images?
Ethmoidal sinus and the, sorry, ma'am.
Coronal sutures. These are the
Coronal
sutures. Yes. And the area, if I ask you how pterion is formed.
Pterion is formed by the meeting point of lambda suture and coronal suture.
Yes, and the involvement of which four bones?
Parietal bone, temporal bone, and the occipital bone.
Okay. All right. Good. Thank you. And here, if we can have a look at the key, if we can see, this was superior or sagittal sinus, 1. And then 2 was straight sinus, it's straight. And 3 over here was the great cerebral vein or the inferior sagittal sinus. And then 4 was sigmoid sinus. 5 was inferior petrosal sinus. And 4 was superior petrosal sinus. And if you could see, 7 was caverna sinus, was here. And 8 was
Stenoparietal sinus.
stenoparietal sinus. Yes, my cursor I can't find. Yes, here. Good. Thank you.